Foods and habits to avoid as an ulcer patient. Do you experience a persistent ulcer symptoms despite treating the ulcer severally? Today, we will expose you to the reasons behind this ugly incident. What is peptic ulcer? Stomach or peptic ulcers are open sores that develop within the lining of the stomach. Ulcer occurs when the protective lining of the gastric walls are disrupted, leading to ulceration of the gastric mucosa. There are basically two types of ulcer. 1. Gastric ulcer. 2. Duodenal ulcer. Causes of stomach or peptic ulcer. The most common causes of peptic ulcers are: first, infection with the bacteria. Helicobacter pylori, also referred to as H. pylori. Helicobacter pylori can damage the protective lining of the stomach and small intestine. This can allow stomach acid to create an open sore, ulcer. 2. Long-term use of non-steroidal anti-inflammatory drugs, NSAIDs, such as diclofenac, ibuprofen, aceclofenac, aspirin, etc. NSAIDs can cause damage to the gastroduodenal mucosa via several mechanisms, including the topical irritant effect of these drugs on the epithelium, impairment of the barrier properties of the mucosa, suppression of gastric prostaglandin synthesis, reduction of gastric mucosal blood flow, and interference with the repair of superficial injury. Third, intermittent fasting may exacerbate symptoms of ulcers due to increased stomach acid production during fasting periods, potentially leading to discomfort, pain, and aggravation of ulcerative lesions. However, research has discovered that prolonged fasting can initiate a healing process in ulcer patient and eventually thickens the walls of the stomach. Note: stress and pepperish foods do not cause peptic ulcers, but they can make symptoms worse. Have you been treating ulcer and it seemed incurable? You probably didn't take note of the following. 1. Ulcer caused by Helicobacter pylori is not treatable using the common over-the-counter antacids drugs. Unless the bacteria is eliminated, the ulcer will persist because even after the lesions might have healed, the bacteria will excavate it again, leading to persistent symptoms. 2. Continuous intake of NSAIDs, such as diclofenac, ibuprofen, aspirin, aceclofenac, celecoxib, etc. 3. Failure to avoid certain foods and habits that may exacerbate the conditions. The following are some of the things to avoid as ulcer patient. 10. Alcohol and smoking. Smoking and drinking alcoholic beverages such as beer, wine, and liquor can inflame and irritate the lining of the stomach. Excessive alcohol use is associated with persistent ulcer symptoms. 9. High fats and fried foods. High fat and fried foods can slow digestion and may aggravate symptoms. Foods fried in oil at high temperatures can upset the digestive tract's natural layer of protection, leading to ulceration of the stomach lining. 8. Acidic foods. Some foods are naturally acidic, and even though they have some health benefits, they are best avoided on a stomach ulcer diet. Such food includes tomatoes, processed carbohydrate foods, example white bread, processed cereals, and others. 7. Citrus fruits. Some people with stomach ulcers may need to avoid or limit the following fruits: tomatoes, citrus fruits, such as lemons, oranges, grapefruits, cucumber, guava, unripe fruits. 6. Carbonated beverages. Carbonated drinks, including soda, soft drinks, can contribute to the production of stomach acid and potentially aggravate ulcers. It is advisable to limit or avoid carbonated beverages if you have an ulcer. 5. Coffee, tea, and caffeine-containing drinks. Coffee, tea, and caffeine-containing drinks, such as energy drinks, can stimulate acid production and potentially worsen ulcer symptoms. It is recommended to consume these beverages in moderation, especially if you have a sensitive stomach, or opt for decaffeinated versions. 4. Spicy foods and mints. Pepper contains active ingredient called capsaicin, which makes food spicy and could irritate existing ulcerations, but on its own does not cause ulcer. Therefore, it is recommended to avoid or limit the intake of spicy foods if you experience pain or discomfort. 3. Chocolate. chocolate can increase stomach acid production, and it has been found that it triggers reflux symptoms, hence should be avoided. 2. Salty foods. Research has found that salty foods may promote the growth of H. pylori, a bacteria that causes ulcer. Therefore, intake of salty foods should be minimized in ulcer patients. 1. Missing meal. As an ulcer patient, missing meals can exacerbate the symptoms of ulcer. During fasting, HCl secretion into the stomach is increased, and this may cause irritations on the gastric linings of the stomach, hence worsening the conditions. If you can abstain from all the things mentioned in this video and treat yourself properly, that ulcer will become history.